Maternal health care remains one of the most crucial health rights for pregnant women. A life may be born, but death may occur. In other instances, lifelong scars may result due to lack of or unavailability of maternal care. Now imagine a situation where a woman or young girl has no access to maternal health care. This, of course, coupled with traditional and religious beliefs, continue to see a significant number of women fall victim to obstetric fistula. My name is Nonhlanhla Ngwenya, and I'm on a journey to demystify obstetric fistula.
Is solely a medical condition.
It's not witchcraft. It's simply a medical condition, and it's something that can be corrected through surgical operations.
Fortunately, this can be treated in about 70 to 80% of the cases can be corrected in the hands of a very good surgeon. Women have to understand that these things happen not only in our country but even in the region. For example, in the sub-Saharan region, we've got about 2 million women who are affected with this condition. So they do not have to shy out, they have to come out and look for help and get assisted.
In the instance of Zimbabwe, what is the ministry doing to make sure that these issues are eradicated?
We start from prevention, and we actually encourage all medical facilities to aim on prevention rather than the treatment. On prevention, it starts with the woman, or rather the patient. We encourage women to get access to family planning, and as Ministry of Health, we make sure that they get access to it and they actually get the commodities. When they get the family planning, it means they do not get pregnant unintentionally. They can actually space their children. And also, as a ministry, we aim at training our health personnel at all levels in emergency training, so that they identify women who cannot give birth normally, who needs an emergency cesarean section, because the solution to this problem when the woman has obstructed labor is to get an emergency cesarean section as soon as possible before there is death of the tissue where the head is impacted. And also, as ministry, we have mothers waiting homes at all hospitals, so that when women are around the gestational age where they can get into labor anytime, they go to the mothers waiting homes, so that when they get into labor, a qualified medical personnel is taking care of them. Their labor is monitored throughout, and whenever there is an emergency cesarean section needed, it's done on time. And also, we encourage these women to book early. We are actually working with the village health workers, so that when they identify any woman who is pregnant, they encourage her to go to the medical facility, book early, so that she gets all the monitoring to prevent the complications.
Access to information is absolutely critical.
Yes.
And which is why I think journalists, community radio stations can help us to spread the word that you know what, you can actually get treated. You can actually get treated. You can get corrective surgery. The government are working together with UNFPA and other foreign doctors who are coming to assist. Have been running these camps, one at Mashoko and one in Chinhoyi. And so for us, the starting point is to spread the word, to raise awareness, to tell women that, look, actually you can be treated and you can be healed. And so one of the ladies who actually got treated, it's one of those stories of hope.
Ndaishungurudzika ndiri munhu wanga akatosungika, asi pandakazowawo naLefias Huruva kuti pane vanobatsira nezvematambudziko iwawo unawo, ndakazoenda kunzvimbo yekuChinhoyi ndobva ndandobatsirwa nadhokta Kanonge.
And she just kept saying, you know, doctor, may God bless you. I never thought I would be healed from this, but I'm healed now. Secondly is to debunk these myths.
Yes.
Yeah, so as Amnesty, we are going to, every time we do a research and we launch a report, we embark on a 2-year campaign and human rights education program. So for the next 2 years, you know, as soon as we've just been stopped by the COVID pandemic, as soon as you know, this crisis, which maybe stops us from traveling, is over, we will be going to the communities to educate people, to educate women that actually you can get healing from this and give them all the information that they need. We now have you know, the contacts of 3 doctors.
Okay.
Yes, Dr. Mpeta at UNFPA, Dr. Nyakanda, who is based in Harare, he's been trained to do corrective surgery, and also Dr. Kanonge and Chinhoyi. So they are now our partners, and then we'll be able to, you know, work closely with them, and also we shared our report with the government, the Ministry of Health and Child Care, and so we will also be working very closely with them in terms of letting them know where some of the people are that we met, that we interviewed. And also, one of the things we want to do strongly is to talk to men, especially so that they can stop this practice. They are committing crimes. So the body of a teenage girl becomes a crime scene. She's going to suffer the risk of getting obstetric fistula because she's so young. So we want this to stop. And we also hoping that our members of parliament, they could, you know, it's a suggestion. They could raise the age of consent, you know, even to even 18, hoping that also men are going to respect the law, you know, when that change has been made. The whole idea is to protect, that's all. Let the young girl grow to become a woman, an adult. So I think access to maternal health care needs to be increased by the state, it needs to be enhanced by the state, which means that there needs to be more allocation towards you know, health in the budget. So there must be an efficient referral system. The primary level healthcare institution must have adequate resources in the form of an ambulance, fuel, on standby. I think it takes a lot of counseling and education for people to understand that this is a medical condition that can be treated. Anyone can get injured, you know, and you know, women are getting hurt. Somebody said whilst on national duty, you know, giving birth and increasing the population for the nation. And why should you be stigmatized because you now have this whole whilst you were, you know, giving birth, and there were unnecessary delays, which are not necessarily your own doing.
Fault,
Yes, not your own fault. There are a lot of factors that we've spoken about. And therefore, people need to change their attitudes. When somebody has that condition, please ensure that they get treatment, help them to get treatment. Sometimes you can help them with just things like getting, you know, the adult diapers, you know, so that they don't spoil their clothing. You know, as a relative, you can assist. We know one brother in Manicaland who actually helped his sister to get treatment. He had to spend some money for that to happen. And he has a brother who said, no, look, this is a medical condition, she can get treatment. And he helped his sister. And because the husband had actually said, no, look, I'm divorcing you, you know. So, but then it's because you do not, it's a lack of understanding. Then one husband actually, they took long, you know, for the woman to get treated, you know, 12 years. We had to persuade him, yes, to allow her time to come to Harare. And, you know, I mean, you know, so these are some of the things that I think even the corporate world, the companies that want to do corporate social responsibility, they should be able to fund some of the women, you know, to get treated. You know, the camps will be coming up soon, hopefully in the spring and the summer. You know, people can chip in, companies can chip in to assist women so that the discomfort is reduced. Because when you reduce the discomfort, you reduce the stigma. When you reduce the possibility of smelling because you bought them the necessary equipment that they need to capture, the leakages, to plug the leakages, then you will have assisted somebody, from the stigma and the discrimination, and even the inability to do work. And people will just, your husband will be, you are a useless woman. So husbands in particular need to be taught, relatives, need to be taught, and so that they understand that, this is something that can be treated, and then that the woman who has suffered from fistula should be accepted and should be assisted rather than discriminated against.
We have 2 centers that are dedicated to the repair of these obstetric fistulas, and we have experienced the obstetricians, surgeons that come in and operate on these women, and locally our obstetricians are also being trained on repair of these fistulas. These 2 dedicated centers are Mashoko Hospital and Chinhoyi Provincial Hospital, and currently women are booking from all over the country. There's a toll-free number that they can just call and they get booked, and once the lockdown has been eased, we can start our camps, because in each camp we can actually do about 60 women. Their money will be reimbursed, the one that they use from wherever they are coming from to the repair center. They will be reimbursed, and they will also be given the bus fares to go back, and also the expenses for the surgery, the recovery, the food and everything is covered. They are just coming for the repair, and then we send them back to the community. The toll-free number is 080 80321. It's totally free. They do not pay anything, and we are actually planning on training them on some of the things that they can do when they go back to the community, like some projects, things that will assist them in surviving when they are healed. Definitely there is life after obstetric fistula.